For this week's discussion, we will be discussing Chapter 1 of Set Phasers on Stun. In Chapter 1 of Set Phasers on Stun, we are introduced to a 33-year-old patient named Voin Ray Cox, going in for his 9th radiation treatment since the removal of the tumor on his left shoulder at East Texas Cancer Center in Tyler, Texas. Mary Beth, his radiotherapy technician who had performed radiotherapy on him 8 times prior, made multiple ignorant decisions along with radiological physicist and Ray's radiological oncologist that led to the death of Mr. Cox. Mary Beth was so used to her daily routines in operating the Therac 25, which is the cancer treatment equipment, that when she accidentally hit the X key instead of the E key, which set different intensities depending on the required treatment, instead of following protocols, she just hit the up arrow key a few times to edit and correct the settings. Keep in mind, it only took Mary Beth a total of 8 seconds to type in the information needed to start the radiotherapy. In addition, prior to beginning the radiotherapy, Mary Beth did not check the video camera, which allowed her to have a visual on Mr. Cox at all times. Moreover, the voice intercom between the 2 rooms was inoperable, meaning there is no visual nor communication between the patient and his technician. Mary Beth's quick edit led to her firing a hybrid proton beam that delivered a blast of 25,000 rads with 25 million electron volts. That's more than 25 times the prescribed dose. Mr. Cox was exposed to the radiation multiple times as Mary Beth could not hear or see Ray screaming for help, telling her to stop. After the incident, both the radiological physicist and Ray's radiological oncologist walked into the scene to check up on the machine and Ray. The conclusion that was made was that they found nothing wrong with Ray or the machine, so they continued use of the machine the same afternoon. Over the next few months, Ray's doctor suspected that he had been subjected to a massive radiation overdose. Ray died 4 months later. Impacts of the events. The impacts of the events led to the death of Mr. Cox and possibly many other lives, since the chapter described the subsequent investigations led to the discovery of similar overdoses in clinics located in Marietta, Georgia, Ontario, Canada, and Jamaica, Washington. Prior to Mr. Cox's death, he was left with massive gaping lesions in his upper body where the tissue had been damaged from the beam. Impact to respective industry, employees, and stakeholders. This event likely led to multiple lawsuits and loss of money, a bad reputation for the facility and its employees, a loss of clientele, as the responsible parties seemed to be rushing the treatment and lacked to pay attention to detail, both critical mistakes when dealing with another individual's life. Things that could have been done to prevent this event. Multiple things could have been done to prevent the disaster from occurring, such as having a checklist and/or guideline to follow prior to the commencement of radiotherapy to ensure all equipment, including video cameras and voice intercoms, are on and running properly, and to ensure the safety of technicians and the patients. Also, having properly trained technicians to prevent rushing, error making, and be able to report a problem before the commencement of the radiotherapy, as well as stopping further use of any equipment or machines that could potentially cause a hazard. Lessons that we should take away from the scenario include the fact that rushing has never been an efficient way to save time, and the events that could follow after are definitely not worth it, in this case, someone else's life. This concludes the assignment for AESC 2870. Have a great day.